got to look at the system and what you don't want to have to be in situations like that where you're the leader of the healthcare team. You have to get the rest of the people around you then to say, employers, you don't want to go in feeding.
That goes out each week up to the minute.
I think we all have agreed that it's really important just to focus on our practice and our ethical standards of how we're going to practice nursing. Are we going to get ahead of ourselves and get out of control and maybe just make errors? Or are we going to slow down, make sure we're doing the right things of using the 5 rights of administration, being a good team player, communicating with our team members, or, so for us, we're just going to make sure we stick to the basics.
So you were forced to do this project, but you learned something.
We learned something, and it was great. Yeah, it was great having the team to work with and learn what it takes to be a good nurse. It's great.
Being in the healthcare industry, our main goal, no matter what it is going to be patient safety, whether that's medications or whether that's putting a Foley in or an IV. That's just the entire goal. And medication errors is something very easily that could be missed just because you're dealing with little pills and a lot of names and a lot of patients. So I just think what we learned was great. And even if some of the studies say that there's not enough evidence to prove between nurse staffing and medication errors, it's still something important to know, whether they have strong evidence or not. So
And do you agree?
it's just good to carry on.
Do you agree that you guys learned something that you'll take with you into your careers by doing this project?
Absolutely. I mean, realizing when we're on the floor, realizing who our team, who's staffing right there and then while we're in the mix of it, knowing the patient ratio per nurse, knowing teamwork, knowing communication, and knowing how the system of whatever facility we are in works.